demonstration speech today is how to take a manual blood pressure. Blood pressure is one of the leading, high blood pressure is one of the leading causes of cardiovascular diseases, and it's very important that people take a particular attention to their blood pressure. I'm qualified to give this demonstration speech because I'm a nursing student, and also I have a high blood pressure myself. This puts me in a position to take blood pressure almost on a daily basis. First of all, to take a blood pressure, you need some equipment. The first thing you need is a hand sanitizer. This is optional, but make sure your hand is clean prior to taking a blood pressure. You also need a stethoscope to take your blood pressure. So the first step is to locate the brachial pulse of your patient or yourself. The brachial pulse is located between the upper and the lower arm on the bony area of your arm, closer to your body. After you locate that, you put the blood pressure cuff on. Make sure it's the right size, because if it's too big for the person, you may get a wrong reading. After you put the blood pressure cuff on, you inflate the blood pressure cuff, and then you deflate to listen to the first beep. That would be your systolic reading, and then the last beep is your diastolic reading. You actually hear a lot of beeps, but you only count the first and the last. For example, if you hear 120/80, the first one being 120 and the last one being 80 means that your blood pressure is 120/80. After that, you deflate the cuff, and then you take the blood pressure cuff off to relax the arm, and then you document your findings. So right now I'm going to take the blood pressure on one of my audience. I'm going to sanitize my hands. I'm going to locate her brachial pulse, which is usually found here. Okay, I just located her brachial pulse, so I'm going to put the blood pressure cuff on. I'm going to inflate the blood pressure cuff. So the first number that I'm seeing on right now is 120. So I'm going to add 20 more to inflate it to like 140. And then I'm going to deflate and listen to the first and the last beat. Deflate slowly. Okay, the first reading that I had was 120 and the last beep was 85, which means her blood pressure is 120/85. To conclude, I'm going to go over the steps again. The first step is to choose the right equipment. You prepare your patient, make them comfortable, choose the blood pressure cuff size, and then locate their pulse. After you locate their pulse, you put on the cuff, you inflate the cuff, and then you deflate and listen to the first beep. After you listen to the first beep, you keep listening until you hear the last beep again. Then you record your pounding. That will be your systolic and your diastolic blood pressure. Thank you.